We met a dentist in Bursa, Turkey, a city known for its medical excellence and advanced dental care. Dr. Kerem Turgut Atasoy has over 14 plus years of experience in oral and maxillofacial surgery.
I have placed more than 60 zygomatic implants.
He explains how this procedure restores smiles when regular implants aren't an option.
Hello, my name is Kerem Turgut Atasoy. I'm an oral and maxillofacial surgeon. I am specialized in Zygoma implants, along for treatments, dental implant treatments, and also oral and maxillofacial surgical interventions. I'm a member of ZAGA Center community, and our clinic is accredited as ZAGA Center Bursa. We are in the second ZAGA Center in Turkey, and there are around 60 ZAGA centers in world, and we are one of that. And that means we have a high experience in Zygoma implants, and we can solve complicated cases. Most patients who lose their teeth are also losing their jaw bones, alveolar bones that support their teeth. And the rest of their jawbone is mostly insufficient. And in the past, we used to make further surgeries to achieve that bone again, to make bone regeneration. Sometimes we used to take bone from their hip, bone blocks from their chin, and these surgeries have their consequences and complications also. So the best option for a patient is the less invasive way and the most long-lasting way. And science have taught us that Zygoma implants are working very good and they are very less invasive. What are Zygoma implants? They are specifically produced implants that reach until cheekbone, your zygomatic bone. And because that Zygoma bone is the strongest bone in our head skull system, and we take a good anchorage from those areas, and we can rehabilitate patients who have no jawbone with zygomatic implants. When we make direct anchorage from zygomas, it's over 95% success, and a patient is undergoing one operation. That's priceless for a patient, especially who is over 65 years old, for example. Also, those patients have accompanying disorders and other medical disease. We mostly prefer Zygoma implants in highly resorbed maxillary atrophic patients. And due to that good anchorage, we can make an immediate temporary prosthesis for a patient who has been using removable prosthesis maybe over 20 years. When they start to use fixed prosthesis and see its comfort, it's priceless for them. If we lose one of our teeth or two of our teeth, we can place standard regular dental implants, which are around 10 millimeters long, while Zygomas are around 50 millimeters long. They are 5 times longer almost, but the mechanism is the same. They are also titanium, they also connect with jawbone, but Zygoma region has a complex anatomy, and Zygoma implant treatment is not being performed everywhere because of that complexity. So high experience is essential in placing Zygoma implants. Especially my young colleagues ask for me if they can place Zygoma implants, but it has a very large learning curve, and in the end of maybe 10 years of surgical experience, I can say that zygomatic implants are the most difficult cases that we have to be very cautious. Scientific literature says that if we perform our operation according to anatomy, especially ZAGA anatomy, it means anatomy guided approach. We follow our patient's anatomy and we choose correct implant according to that patient anatomy. We can make that precise osteotomy and we can place the precise implant. Success is very high in Zygoma implants, but because that treatment requires high experience, and if we don't follow its guidelines and its tricks, sometimes it may be very complicated. So if we make our operations in both Zygoma and dental implant according to the right rules, success rates are almost similar and over 95%. Mostly patients ask us, will I have pain after operation? And because we may intraoperatively and postoperatively some medical interventions to avoid that pain, most of our patients say that I was very comfortable and I didn't need to use your painkillers, but I asked them please use them because they are also to avoid swelling. When we make a surgical intervention, patients experience slight swelling, edema, and we administer them ice from outside. When you apply ice from your skin to the operated area, your swelling will decrease dramatically, and that ice along with medical support, you may feel a slight swelling in the first week, and later on it will decrease, and your natural healing mechanisms will solve this issue. For both alone for Zygoma or conventional dental implant treatments, we have two visits. First visit is for surgery, and we mostly need 5 days for the first operation, and we arrange our operation hospital, and we take your 3D images and prepare our temporary prosthesis. And after that pre-operative preparations, we make our operation, and mostly 2 days later we deliver your temporary fixed prosthesis, and this is the first visits time, which almost takes 5 days. For the second visit, we take your digital impressions and we make try-ins and we see how they look. We also show you the result with artificial teeth, and so our patients can see in the final result before the prosthesis is delivered. That visit also takes maybe 7 days. For all treatments, dental implants, all-on-fours or Zygomas, period is similar. When we deliver a temporary fixed prosthesis to our patient, we recommend to consume soft diet, because when we apply high forces, high achieving forces against our implants and temporary prosthesis, there are 2 risks. One is about implants, which means our implant can disconnect from our bone. And second is breaking of our prosthesis. Second is more favorable, but we don't want to leave both of these 2 complications. So for patients who undergo such treatments, we also recommend them masseter Botox, which means we make Botox to the chewing muscles to avoid excessive forces against those temporary prostheses. And second is oral hygiene maintenance. When we place a temporary prosthesis, it needs to be cleaned, especially the borders of finishing lines of that prosthesis, the margins of that prosthesis need to be brushed properly. And if we keep that oral hygiene good, and if we make soft diet consuming for that 3 months of healing time, risks will decrease and both of us will be happier. Zygoma is my favorite treatment modality because it really transforms patients' lives. And mostly these patients are hopeless. They have visited more than 20 dentists mostly, and because that treatment is not being offered everywhere, and these patients, they say, I am not a candidate for dental implant, they say. But when I inform that there's another option, in the their first reaction is, don't be silly, I have no bone. I say, yes, I see you have no bone, but there are other options. And when I explain them with that final results, they see the before and after cases. They believe in that method, and I also show them scientific literature, and they are convinced that these are my favorite treatment modalities.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.